is normal. Good, and we're normal. Now we're going to observe the ears, starting with the auricles and the mastoid area. Okay, so first I want to look at size and shape. You can compare, looking for symmetry, any landmarks, lesions, looking at the color. Also I want to palpate in the mastoid area, hoping for no nodules, any signs of infection. Any tenderness noted?
No.
Miss Marshall, I will assess now your auditory canal, pulling forward on the tragus. I can straighten that ear canal, going into the auditory meatus. I'm assessing for cerumen, which is minimal. There's no impactions. There are no inflammation or redness, no sign of infection. I can see your auditory meatus. I can see your tympanic membrane, which is pearly. Movement and mobility seem appropriate. The shape is appropriate. I'm not seeing any. I can actually see the ossicles behind it. No perforations.
Mm-hmm.
Let me know if there's any pain while doing this. If you do it appropriately, there should not be any pain. Okay, now we're assessing for hearing. Hearing, pretty simple. You can just assess for appropriateness of responses during your assessment. But then there's also this tuning fork here that you can do. This is called the Weber test. You activate the fork, sticking the base at the crown of the head. Do you hear it louder on either side?
No.
Is it the same on both sides?
Yes.
Good. And that's a pass on that. Now we test for bone conduction versus air conduction in the Renee test. Tell me when you stop hearing this as I hold the base of this over your mastoid process.
No.
Now tell me when you stop hearing this.
No.
Now the latter was air conduction, and we want that ratio to be about 2 to 1, meaning air conduction should be greater than bone conduction. Sometimes it'll be 3 to 1, but 2 to 1 at least indicates that hearing is appropriate. Now your patient is sitting away from you. I'm going to do the whisper test. First occlude the tragus here and rev it. Is that obscuring your hearing pretty well?
Somewhat.
Okay, so press a little bit harder. How's that?
Yeah.
Okay. About arm's length away, you whisper into that ear a set of numbers and letters. A, G, 6. Repeat that. What did you hear?
A, G, 6.
Good. Okay, then we do the other side, and we repeat that step. How is that occluded? Is that well?
Yes.
Good.
D, A, 5.
Great, okay, and it'd probably be good to use letters and numbers that you might not mix up, like T or D, B or P, but she passed that. Now I want to take a look at your nose. Okay, so I want to look anteriorly. I also want to look, so anteriorly, laterally, and inferiorly. If you want to face me real quick. Okay, we didn't seem to have any changes in bone or cartilage, no asymmetrical on the outside. And now let's take a look at the size, the shape, the color of the nose. I'm palpating for displacement. Any pain?
No.
Good, no masses. Now the patency of nares. I want you to occlude one nostril and breathe in and out. Now occlude the other nostril. Breathe in and out. Any resistance on either side?
No.
Okay. Now I'm going to have an inferior view of the nares going inside. Medially, I should see a septum, and laterally, I'm assessing for what's called turbinates. Both are appropriate in size. Both are symmetrical. Okay. Any difficulty breathing or smelling?
No.
Okay, I don't see any perforations. And now I want to look at your sinuses. First the frontal, which is up here, and when we palpate the frontal, we go under the brow here. Any pain?
No.
Okay. This side now. Any pain?
No.
Okay, and when we percuss the frontal sinus, we go on top. Any pain?
No.
Okay. Any pain?
No.
Now for maxillary sinus, we go up and under the cheekbone and press up. Any pain?
No.
Okay. Pain?
No.
Now palpating. Pain?
No.
Pain?
No.
Good. Now I want to inspect and palpate the mouth and throat. I'm going to look at the internal and external lips. The color, everything is pink. There's no swelling, no nodules. I'm checking for edema. I want to open the mouth real quick. I'm going to look at the gingiva or the gums. No swelling, no separation. I want to see your tongue. Now looking for color, symmetry. Stick that out for me. Good. Okay, go right and left. Good. We're looking at the hypoglossal nerve here. I'm going to stick it out for me a few times. Good. Go against the pressure of my, at the inside of your cheek, stick your tongue out. And go against the pressure. Put your tongue, there you go. And then we'll go this side. Good. Both are appropriate. I'm, again, looking at your tongue. I'm looking for lesions, any tenderness present, anything like that?
No.
Okay. Now looking at the tongue, I want to see for any ulcerations. We're good on that. I want to look for uvular eyes. Open up. Now say ah.
Ah.
Good, that did so. Now we're going to look, say ah again.
Ah.
I'm looking at your tonsils. There's no swelling there, no discharge, no apparent infection. The posterior wall of the pharynx, again, no swelling or discharge. Lastly, I want to assess the gag reflex. I'm going to the posterior portion of the tongue. Sometimes you'll have to hit the uvula or go even further. Good. And that is present. And that is the EENT assessment. Now we observe for the 6 cardinal fields of gaze. We're going to have your patient hold their head completely still and follow an object of focus only with their eyes. So now we start with their upper left, lateral left, lower left. And while doing so, you can ask them to check to see if they're seeing anything in double. Upper right, lateral right, lower right. Also, you want to observe their eye movement. If you have any sudden jets of the eye going one direction and then having it slowly move back into place, then they might have what's called nystagmus. Now I'm using the ophthalmoscope, and because everyone's eyes are different, you have to kind of discover your own refractory power. At anterior portions of the eye, while I'm assessing, I'll be at an 8, and when I'm looking at posterior portions, I'll be looking at about a 6 power. Okay. So first I want to look for, flip that light on, and tell your patient, if you become uncomfortable at any point, you can stop this exam, you can take a break, because this can be very uncomfortable with the light shining directly into your eye. So at that higher diopter, I'm looking at the anterior portions first, and I'm going to cover the right side of her brow with my left hand, and I'm going to observe with my right eye. First, anterior portions, looking for lens clarity. Good. I'm seeing red reflex already, but you can stand about arm's length away and find the appropriate diopter. And once you do, you'll see. So you want to grab a seat. Good. Eyebrows aren't too thin, not too coarse. These things might indicate, for example, hormonal abnormality, like hypothyroidism, for example. If we have the outer brow here extending somewhere before the edge of the temporal canthus, then that could be an indicator of hypothyroidism, for example. All right, Ms. Marshall, we're going to check the orbital area now for periorbital edema, excessive redundant tissues, lesions. If you have yellow lesions, it could be a sign of lipid deposits, showing that you have issues with lipid metabolism. And so first do a visual check. If it requires, you can palpate and you can look. Edema could be a sign of some kind of an allergy or sensitivity or perhaps congestive heart failure. I'm now going to observe your eyelids. Close your eyes for me nice and soft. Okay, observing for fasciculations or tremors. Good, open your eyes as wide as you can. Close your eyes now tight, observing your ability to do so. Now looking around the margin, we've got no flakiness, no redness or swelling. That's good. Eyelashes are on both eyelids and are curving outward away from the globe. I'm going to palpate now for nodules. Okay, now observing for ptosis. If your upper lid is obscuring your pupil or obscuring more of the iris than in one eye than the other, then we could have ptosis. I'm not noting that. Okay, good eyes. Okay, I'm now going to assess your conjunctiva and sclera. Okay, first I can palpate for lacrimal gland punctuation. Good, now I'm going to hold the brow here and bring that lower lid down and have you look up that way. With my pen light I can illuminate, look for any trauma like subconjunctival hemorrhage, anything like discharge or foreign bodies. I'm not noting any of that. I'm going to do that on this side as well. Have you turn toward me. Up and to the right. Good, nothing like that. Also looking for pterygium, and that is extension of the conjunctiva past the corneal rim, and I'm not noting any of that. And we're good. Okay, now I want to assess the clarity of the cornea, looking for no innervation of blood vessels, and that's good. I also want to see the sensitivity of the cornea as well. That should elicit a blink, showing the trigeminal nerve is innervated. Now I want to see of any arcus, and that's a cloudy deposition of lipids around the rim of the cornea, sometimes around the entire rim there. None of that. Good. Now I want to look at the irides. The color should be the same on both sides. Now the pupillary characteristics, we've got size, centeredness, that all looks good. Also want to look at direct and consensual response to light. And so we do that by shining light in the same eye and observing that pupil and its direct response. Then giving that eye a break and then shining that light in that same eye, only changing my observance to the other pupil and looking for a consensual response, which should be acting in the same manner as that first pupil. Okay, so this whole time I'm looking, this whole time I'm shining here, and I'll be looking at alternate areas. So here we have direct, pupils have constricted, give it a rest. Now I'm looking for consensual on the other side. Consensual, pupillary constriction. Now I'm going to do the same with this eye, observing first, direct, constriction, very good, give it a break. And now observing for consensual. Good, pupil rest. Supposed to have them stand 20 feet back from the chart. Our chart is much smaller. It says 6 feet back, but it works the same. So Ms. Marshall, if you could please stand 20 feet back from the chart and read the lowest line that you can before the letters become too obscured for you to be able to read. But first cover your left eye.
T, F, P, H.
Great, that was perfect. Okay, now please do that with the right eye. Cover the right and read from left to right.
L, T, F, P, H.
Okay. All right, now read the lowest line that you can before it becomes too obscured to read, and don't cover either eye.
L, T, F, P, H.
Perfect. These numbers on the right here indicate her visual acuity. 20/20, for example, she was able to read, meaning at 20 feet, my patient was able to read what a person with normal vision can read at 20 feet.
Next. Acupressure point, heart 8. When the palm faces upward, the point is between the 4th and 5th metacarpal bones. I instruct my patients in clinic to apply the fire element AccuStick containing pure essential oils several times per day to activate this point and initiate the healing potential of heart 8, which is to cool heart fire. This point is specific for heat in the heart, and they can use a counterclockwise motion to stimulate this point with medium pressure if they have time during the day to actually use acupressure. Now, heart heat is going to show as possible insomnia or emotional upset, and if you want to regulate the heart and support the heart, you would probably choose heart 7 instead of heart 8. But if you actually have heart heat, then you utilize heart 8. One way you can possibly see if you have heart heat is to look at your tongue in a mirror and see if the tip of your tongue is redder than other areas, or it's more deeply red.
So today we're going to be doing cosmetic acupuncture for lines and wrinkles. And we have our beautiful Lisette here. So I'm just disinfecting the skin. So cosmetic acupuncture is done to promote circulation in the face to achieve that beautiful natural glow. Build collagen and elastin. Those are the two proteins that mainly make up the structure of the skin. She doesn't really have wrinkles or lines. You could see just the beginning of a nasolabial groove being slightly noticeable. So with cosmetic acupuncture, what you want to do is, and let's move your head over here like this. First, you insert the needles into the wrinkle itself, and then you pick specific acupuncture points on the body. So we're just going to start with this line right here. How was it? It's okay?
Mm-hmm.
And you want to get it subcutaneously, and that's where most of the collagen elastin production occurs. And these needles are very thin.
Nice, sweetie, nice. Beautiful.
So far, so good?
Mm-hmm.
Other than placing them subcutaneously into the body and doing specific acupuncture points on the face, you also want to stimulate and tonify the spleen, because the spleen is actually responsible for production of collagen and qi. You just want to gently tap on it like this to stimulate. Good so far?
Mm-hmm.
Should be a very, very mild discomfort. So after this is done, you can go ahead and place spleen tonification points on the rest of the body and use actual TCM. You notice the area around the needle is getting nice and pink, which is called hyperemia, and that's the blood flow to the skin. This is exactly what we want. So now that this is done, I will place needles in specific acupuncture points. Just stomach points. Oop, lost that one. There we go. So this is an alternative to Botox. It's a natural facelift procedure. You generally need a series of them. I say start with 6 to 8 and then do an evaluation. Oop, they're so fine, they're flying everywhere. Can you feel them? No. Place one more in here to tighten up this muscle. So generally a wrinkle forms due to weak flabby muscles and very tight muscles. So with acupuncture, we're trying to relax the tension, the tight muscles, and tonify the weak. Have to be a little careful around the eye so that we don't accidentally bruise her. But these needles are so fine that it rarely happens. Let's have you turn like this. There's also a very good procedure for acne, rosacea, dry skin. Let's see, let's do just very early stages of liver lines here. Those 11s. So we want to needle up like that. And of course, after every acupuncture session, what you want to do is moisturize the skin, keeping it nice and moist, drinking lots of water. Give these guys another round of stimulation. Now this is just manual stimulation. What we can do is hook it up to an electrical stimulation machine and run a mild current of about 50 hertz to boost the production of collagen from the dermis. To lift the eyebrow. And into the frontalis. Okay, so generally you would do both sides, and we're doing just one side as a demo today. Feeling good? Mm-hmm. Minimal discomfort? Mm-hmm. Okay, thank you. So we're going to give them another round of stimulation. It has been about 30 minutes, which is the general time that you want to retain the needles for. Give them a little tap. Just like that, bringing more blood flow to the skin. Okay. And we're going to prepare to take them out. Okay, so we'll start removing them. You want to have the cotton ready just in case you get a little drop, but it looks beautiful. This one. Just apply light pressure. And they feel much better on the way out, right? Going in, they don't hurt, very minimal discomfort, like I said, but on the way out, it's practically unnoticeable. And we didn't needle the left side, we did the right side, so we'll have it for comparison. You can see we got a lot of blood to the site. So depending on how mature one's skin is, you would follow up acupuncture with, like I said previously, an electrical stimulation or a German engineered tool that many of you have heard, which is called the derma roller or microneedling technique, which is basically you've got a stick and a head with about 600 microneedles, and you roll it all over the skin, and that helps to resurface the skin, and that helps to bring more blood flow to it, assisting it in acupuncture with our results. So let's compare the two sides. You can actually tell, can we zoom in on a little bit? You can actually tell where the needles were. So right now, right here, there is a lot of processes going on, and the blood is at the site, and we're going to have a slight edema, but that's natural. Now the body is going to be depositing collagen and elastin into these sites of micro-injury, so to speak. So usually what I do is I like to apply a little bit of a hyaluronic acid or any anti-wrinkle cream that you may have, something that will help us to firm the skin. Also, after acupuncture, the pores are open into the skin, so anything that you apply will get absorbed at a very high percentage. Okay, so go ahead and smile for us. Any discomfort? Feels good, and she didn't even bruise. And you can tell, comparatively speaking, that the two sides look very different, and we're going to have to do this side to fill this in a little bit too next time. All right, thank you for watching. Thanks, Lizette.